A few years ago, orthopedic surgeons began experimenting a bit, if you will, with a thing called PRP, or platelet-rich plasma. 3.5 years ago, we at Franklin Orthopaedics also launched our PRP program. I'll admit I was a little skeptical at first, but I'm really glad that we have been able to offer PRP. PRP again stands for platelet-rich plasma. Platelets are these cells in our bloodstream that help promote a healing response. You may be familiar with platelets because they help also promote clotting. And so let's take the example of where you have perhaps a laceration somewhere. The platelets are in your bloodstream, so as you bleed from that injury, the platelets are right there on the scene, and the first thing they do is they help clot the blood to control the bleeding. But now they're positioned right in the middle of that clot, and the really cool thing about PRP is, or about platelets, is that they don't quit doing their job at that point. They're sitting there within that clot as the architects or the engineers of the healing response. And in the miracle of our being able to heal injuries, platelets are right there releasing growth factors and modulating the various pathways that lead ultimately to healing. And so a few years ago, orthopedic surgeons became interested in how can we harness the healing power of platelets to help promote healing in perhaps tendonitis, bursitis, tendon injuries, arthritis, and we found amazing results in many cases. You can take the example of patients with arthritis. The most common arthritis that we treat is arthritis of the knee. We treat arthritis, of course, elsewhere, but in the case of knee arthritis, we have options of cortisone injections. There's a group of drugs called viscose supplements, which are lubricant type shots, and then we have PRP. And we've had many patients that have tried the first two options that I mentioned, had equivocal results perhaps, and they've tried PRP and in many cases had great results with pain relief. PRP, again, platelet-rich plasma, is used to help more quickly promote a healing response with injuries. There's a great study out there that shows with a simple and common ankle sprain that patients can return back to their sport as early as 30 to 40% quicker by being treated with platelet-rich plasma. We use it in areas of other tendon injuries. Hamstring tears, for example, have been treated effectively with PRP. So it's an exciting new field. It's an exciting new option that we have for patients. The procedure to get PRP is really very easy. You come in and we do venipuncture, which is a medical term for drawing blood out of your arm. We get 15 cc's of blood, which is a ½ an ounce. We process that here in the office using a procedure that takes 5 minutes, and we separate out your platelets and your plasma from your red and your white cells. We then come back in with your PRP, and then we inject that into the place in your body where you need that healing action.